This is Dr. Archana Karthik. I'm the fertility specialist from Ovum Hospital, Banashankari. Today I'll be telling you about brief knowledge about oligospermia. We have many patients who come with only a female investigations. They say, doctor, get my wife's investigations done. Maybe she has some issues. No, up to 20 to 30% of the cases, solely male is responsible for infertility. So that is also very important for us, and we should be simultaneously tackling both male and female infertility factors. So briefly, let us know what is this oligospermia. Oligospermia means the sperm count which is less than 15 million per ml. That is a concentrate which is given by WHO. So the reference is like 15 million. So again, in oligospermia, we divide it into mild, moderate and severe cases. Severe cases is like when the sperm count is less than 5 million per ml. Coming to the causes, doctor, who all are having this kind of, especially when a male person comes to us, they usually ask, what is the cause? Why I have this kind of issues? Let me tell you, up to 50% of the patients will not have any causes detected by any of our investigations. Remaining only we can make out some 40 to 50% of the patients we can identify this is the cause for the kind of oligospermia or azoospermia, whatever the problems it has. So coming to the list of the causes, the first and foremost cause is the stress and the lifestyle, especially smoking, overnight working without a long hours of sleeplessness, and diet, which is actually with endosulfans or chemicals. Most of our food is adulterated. That may be one of the reasons nowadays oligospermia is common. Along with that, there are some hormonal issues like maybe thyroid issues, or there may be hypothalamo-pituitary axis problems where there is hypothalamus hormonal defects, or there may be a primary testicular failure where there is production of milk from the testis due to some genetic causes, which is very rare, but yeah, that is also a cause for oligospermia. There are some drugs. You might have heard people take steroids, people take some of the hormones, antidepressants and all for steroids, usually for bodybuilding. They take the steroids over the counter. These can cause oligospermia. They'll have sperm defects. Even testosterone is taken by some patients, which can cause oligospermia. There may be some infections also, like the sexually transmitted diseases or kind of mumps which is seen in childhood, that can affect the oligospermia, or there may be decrease in the sperm production, or there may be some previous surgeries which might have obstructed the tract. That is called obstructive oligospermia or azoospermia. It is also a cause. So how do you know this, like you have oligospermia? See, usually with an abstinence of 2 to 4 days, we ask the male to give their semen for the analysis. In the seminal fluid, we count the sperm. If it is less than 15 million, the count, then we say it is oligospermia. We even check the motility and morphology and some other tests also. Mainly these are the 3 things which we have to see for the fertility factor. And along with this, if at all we find some defects in the semen analysis, then we'll go ahead with other investigations like hormonal assays, thyroid, FSH, LH hormone, or we'll go for a scrotal ultrasound also. And very rarely we may even go for a genetic testing for the chromosomal analysis. Coming to the treatment part of it, this is very important. After knowing what is happening with the patient, next thing is it treatable? The question is whether I can produce my own embryo or the fetus. This is the question by our patients. So yeah, majority of the cases we can treat them with medicines and lifestyle changes, especially smokers and alcoholism and stressful life can be changed along with dietary modifications also, and we can give them some antioxidants. If it is a moderate or mild grade of oligospermia, that will definitely affect, there will be changes in the semen analysis after 3 months of treatment. Minimum 3 months is required for the change to be seen. And there are some surgeries, especially you might have heard varicocele. Varicocele is dilatation of the veins around the testis. That can be treated by surgery. And if not, all the patients with varicocele may not have improvements, but majority can get improved with a varicocele surgery. And there are some drugs and hormonal injections which we may try on these patients for the improvements. So definitely take home message by this talk is that the causes 50% we can't make out, and the majority of the conditions can be treated. And ultimately, if your count is not improving, if it is like less than 5 million but still you have sperms, we can go for IVF treatments. In IVF or ICSI treatment, we can get your own baby. You can get your own baby and we can help for you. So any doubts, any further things you have to find out about your infertility, especially the male factor, you can come to us and we will tackle everything. And need not worry that you have to go immediately for a donor sperm. We have some options. We can try them initially, and then the last option is donor sperm. Please don't take everything in a negative way. So have hope even with male infertility and come to us for further treatment. Thank you.